Fix hooded eyes on monolids. I have hooded eyes as well as monolids. I'm not looking to get double eyelid surgery, as I actually quite like the look of monolids. I was wondering if it was possible to get surgery that would fix my heavy hooded eyes so that my lash line shows. Makes applying makeup easier. Looking straight on, it's just a monolid with a slight indent. Looking up, a crease line shows, but my eyelids remain hooded.
Thank you for your question. You submitted 2 photos, and you're asking in your question, is it possible to change the monolid that you have conservatively so that you only see the lash line? And you describe in your question that when you look straight, you see a monolid or no eyelid crease or double fold. But when you look up, you do get a fold appearance, which is demonstrated by the photos you submitted. Well, I'll give you a little bit of perspective on how I evaluate patients like yourself who come to our practice with comparable concerns. A little bit of background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island, and I've had a long-standing focus on the art of Asian eyelid surgery. And I can give you some ideas of my evaluation process and how I guide patients like yourself. Well, first of all, let's understand why things change when you are looking straight on and looking up. I would say that just from the photos alone, it seems that you don't have any evidence of excess fat, and there probably is not that much redundant or excess skin. And this is the first question that I ask to myself when I'm doing an evaluation. If you want to have this level of conservative appearance where most of the platform of the lid is covered by a fold, but a small amount of skin that is right now rolling over the eyelashes is now going to go back, then generally that's a very strategic placement of sutures to pull and tether the skin in a way to create that appearance at rest. Now, there are essentially one concept, or there's basically one concept that you have to understand. Asian eyelid surgery, which there are more articles than you would imagine published for decades on best ways to do Asian eyelid surgery from very, very experienced surgeons. And the point of that is that there is still some basic principles, and that is where the skin is fixated, which is usually at the highest point of a level called the tarsus, or at a juncture where the levator muscle and the tarsus basically cross over, or basically the levator muscle goes over the tarsus, and that's where the crease typically forms. When you're looking up, because there's no fat, a form of a crease does form. So generally, when I'm making that decision point, usually for someone like yourself, there isn't skin to be removed. So I would use something like a non-incisional eyelid surgery approach. Now, essentially what I'm doing is fixating the skin in a way without removal of skin. That means making little dots and openings in the skin and then placing sutures in a very strategic way to engage the muscle, the levator muscle, and the skin. So to determine what kind of future crease there will be, I use a simple instrument to just push the skin upward. You know, there's been examples of using just the blunt, rounded part of a paper clip. I mean, there's just a few ways to do this, but essentially, it's a guide to see what would happen if the skin were fixated at this point. And usually it's a point somewhere towards the center of the eyelid and maybe slightly lateral in order to get a nasally tapered crease or a nasally tapered fold. So now a lot of times when patients like yourself come to see me and they see the amount of skin that's being revealed, very often they think it's a little too much. In other words, because there's just not that much skin to work with, and so just a little bit of fixation causes the skin to ride up and they see too much of the lid. So this is a question that really requires physical examination. I would say that it is possible to create that effect that you're looking for. However, it has to be with some degree of compromise. When you are looking straight ahead, to be able to see the eyelash line and to not have the skin roll over and push on the lashes. However, when you look up, you will probably still have some degree of folding in a way that might be more than one fold, because you're now creating a fixation point to suspend the skin in a way so that the lash line is seen. So evaluation is first to be done by by an experienced cosmetic surgeon who does a lot of Asian eyelid surgery, who understands this from experience and understands the principles and does this enough so that they can do it with confidence, and just basically see what would happen without skin removal. How much are you willing to accept? If you see a little bit more than just the lash line, would you be satisfied? And if the answer is no, then you should probably wait to do anything or defer the procedure. But I think you're going to need to get a couple of opinions before you make that decision. So I hope that was helpful. I wish you the best of luck. Thank you for your question.